This feature is brought to you by JPHMP Direct, an online community for advances in public health. With us today is Dr. J. Maddock, and discusses academic impact and the use of dissemination to achieve this.
Why do metrics such as impact factor and H-index only measure part of the public health scholar's impact in the field and in the world?
Well, when we think of public health, I think we're thinking of a very different field than what you typically see in academia. If you're a physicist, really your research is read by other physicists. But for those of us in public health, really our work should be having an impact on the health of populations. And so, well, H-index will tell us how many scholars are citing your work. What we really want to see is what effect does your work have in the community? So does it actually make a difference? And it's a piece of the overall picture when we start talking about impact in faculty.
To what extent has dissemination traditionally been undervalued in academic and scientific disciplines?
I think we've almost not looked at it outside of dissemination to other scientists. And so if you look at traditional tenure and promotion packages, we say, how often is another scholar citing you? And really, your impact in the community has been zero. No one's cared about it. It hasn't been reviewed. I think that's a big loss because really, if you're not making a difference, why are you in public health?
What is the relationship between dissemination and measurable impact on population health?
I think there's a huge relationship. Now, it's going to depend on where you are. Obviously, someone that's in biostatistics maybe have less of a role. But if you're in community health and epidemiology, health policy and management, you're hoping that those fields are having a big effect. And so, we had a faculty member at Texas A&M this past year who did a lot of work looking at the effects of laws around texting while driving. And she found that states that had comprehensive laws saw a reduction in the number of deaths they had in their state. So she was called into the Texas legislature several times to present on her research. And her research was the basis of a new law in the state of Texas, which will save lives. So to me, that's such an important part of what we do. It takes time to go and testify and go to the Capitol, but I think it's such an important thing for anybody in public health to take that extra step. And we know if we don't reward it, then people aren't going to do it.
What are some of the best means of disseminating research findings?
There's so many different ways to disseminate, and I think it depends on what type of work you're trying to do. And so, if it is policy work, certainly testifying to the legislature or the county council makes sense. Having short briefings that you can talk with policymakers about is important. But if it's for the community, really saying, okay, how do I put this into ways that we can get in front of community members? It might be in a clinic or hospital setting. It might be just out at a health fair. It might be in the local school or a sports organization. And so we try to find ways that get people where they are. It's hard to get people with all the information that we have today. They're not going to look for it. You really need to be able to get in front of them. So I think that's the biggest thing. And then suiting the dissemination to the amount of time and space that a person has.
How can deans and other university administrators assist public health researchers and practitioners in disseminating their work?
Yeah, I think there's a few things. One is really the incentive side. And so we've looked at Texas A&M about our tenure promotion criteria, and we have added a section on impact. And so while that's, by itself is not going to get you tenure promoted, it certainly is a factor that we can count as a positive for folks. So having that incentive is important. And then I think we try to provide trainings for people. Say, okay, if you're going to be working with the media or with the legislature, we can bring in people that have good expertise in those areas, and they can help you. How do I do effective testimony before an elected official? How do I speak when I'm on camera? And so helping build the skills. A lot of times faculty are never trained in their graduate program, so we try to be able to offer those to our faculty.
And that concludes our special feature with Dr. J. Maddock, Dean of the School of Public Health at Texas A&M University. To learn more about this topic, visit journals.lww.com/JPHMP.